Today we'll be talking about sterilization in healthcare, especially in hospitals. Sterilization in healthcare is the complete removal of all microbial life from an object or an environment, which is different from disinfection, which can only reduce the number of microbes. This process is crucial in nursing because it prevents the spread of healthcare associated infections, protects patients and staff, and ensures the safety of medical equipment. Nurses are on the front line of this effort, making a solid understanding of sterilization and fundamental part of their practice. Now let's dive deep into the nitty-gritty. The microbiological basis of sterilization relies on targeting and destroying the cellular components of microorganisms. Sterilants, whether they're heat, chemicals, or radiation, work by denaturing proteins, disturbing cell membranes, and damaging nucleic acids, like DNA and RNA. The most difficult microbes to kill are bacterial spores, which have a thick, protective coat that makes them highly resistant to many disinfections. Therefore, an effective sterilization process must be sporicidal. The clinical significance of sterilization is the prevention of disease transmission. When instruments used for surgery, injections, or wound care are not sterile, they can introduce pathogens directly into a patient's body, leading to serious infections like sepsis or surgical site infections. This not only harms the patient, but also increases healthcare costs and antibiotic resistance. Every year, millions of dollars are spent treating HIAs that could have been prevented with proper sterilization practices. The use of sterile instruments is a cornerstone of patient safety and is a key component of universal precautions. In a real world application, sterilization methods are chosen based on the type of medical device and its material composition, such as steam sterilization, in other words, autoclaving, is the most common method for heat and moisture resistant items like surgical instruments and linens. It's fast, reliable, and cost effective. Autoclaves use high temperature, high pressure steam, typically 121 to 134 Celsius or 250 to 273 Fahrenheit to kill all microbes, including spores. There are two main types of steam sterilizers, like gravity displacement sterilizers, simply displace the cooler, denser air with steam. Also, high vacuum sterilizers use a vacuum pump to remove air from the chamber before steam is introduced, allowing for better steam penetration into complex or porous items. Furthermore, low temperature sterilization methods are essential for items that are sensitive to heat and moisture. Let's dive deeper into the topic. Let's bring up ethylene oxide, also known as ETO. Gas is a powerful sterilant used for plastics, delicate instruments, and other sensitive materials. It works by alkylation, a process that modifies the DNA and proteins of microorganisms, rendering them unable to reproduce. However, ethylene oxide is a toxic gas, so it requires a lengthy aeration cycle to remove residual gas from the instruments before they can be used safely. Vaporized hydrogen peroxide, in other words, VHP, or gas plasma, is a safer and faster alternative to ethylene oxide. It sterilizes items using a plasma field created from hydrogen peroxide vapor. This process breaks down into safe byproducts like water and oxygen, eliminating the need for a long aeration phase. Furthermore, liquid chemical sterilization is a method used for instruments that cannot withstand heat or needed for rapid reprocessing. Periodic acid are common agents. While effective, this method is not as reliable as steam or gas sterilization, and items must be used immediately after process. To ensure that sterilization has been effective, hospitals use a multi-layered approach to quality control. Biological indicators, which contain highly resistant bacterial spores, are the gold standard. If the spores are killed after the cycle, it confirms that the sterilization process was successful. Chemical indicators provide a quick visual check that the items has been exposed to the sterilant, but they do not confirm that the microbes have been killed. Finally, physical monitoring of the sterilizer's temperature, pressure, and time provides a record of the cycle parameters. Now let's delve deeper into the RN focus. As a registered nurse, you are an essential part of the sterilization process from preparation to use. You should assess first. Before use, you must assess the integrity of sterile packaging. Look for tears, holes, or signs of moisture. You must also check the sterilization indicator, a chemical strip or mark that changes color to confirm the item has been through the sterilization cycle. If the packaging or indicator is compromised, the item is considered non-sterile and must be used. Next step would be the intervention. Your intervention include proper handling of sterile instruments using aseptic technique. This means keeping a sterile field, not touching sterile items with unsterile hands or gloves, and maintaining a safe distance from the sterile field to avoid contamination. You also participate in the initial decontamination of instruments by rinsing them to remove gross debris before they are sent to a sterile processing department. Nurses are also responsible for documentation, ensuring that the lot number and expiration date of all sterilized items are recorded in the patient's chart to maintain a clear record in case of a recall or infection. The next step would be patient education. You can educate patients and their families on the importance of infection prevention. For example, for patients with surgical wounds at home, you can teach them proper wound care techniques, including how to handle sterile dressings and the importance of hand hygiene to prevent infections. You can also explain to them why a specific medical device, such as a catheter, must be handled with sterile technique to prevent an infection. Your role in education patients empowers them to be active participants in their own care and infection control. Now, finally, I will close it off by saying thank you very much for listening, and I will summarize what we've gone through. Sterilization is a crucial process that protects our patients from life threatening infections. It's a fundamental part of microbiology and a core responsibility of every nurse. Remember, the difference between a sterile and non sterile item can be the difference between a patient's recovery and a serious infection. Question for the class discussion: how can nurses advocate for stricter sterilization protocols in their own department to improve patient safety?